In that stimulus bill I'm referring to, they had the first wave of moving us towards a socialized healthcare plan. They called it comparative effectiveness. Comparative effectiveness is where they took $1 billion, they've given most of it to the National Institute of Health, to go out and determine what the most optimum treatment is for any illness or injury. And then that's all they're going to fund. And I didn't realize how acute that was. It's even present today in Medicare. A lady named Ginny Job, who lives here in Johnson County, came to my office for health care. Never should anybody in America go to an elected representative to get health care. But she came to my office for help. The reason is she has an immune deficiency and she cannot fight off the common cold. But she was living a normal lifestyle, playing with her grandchildren, going out to shop, visiting friends and neighbors. But when she turned 65, she went in to get reimbursed for the medication that she was put on by her physician. And Medicare said, well, we don't fund that. This is the optimum. We fund this medication. Since that time, she's been having headaches, backaches. She had a cold. She has a mask on. She came to see me, and when I wanted to shake her hand, she says, Todd, you know, you shake a lot of hands. I'm sorry. Well, I couldn't shake her hand, and rightfully so, because I do shake a lot of hands. But the point is, she was put on a medication that is an optimum, just like they're pursuing comparative effectiveness, and it's limited her choices. She is experiencing what we call rationed health care. Not everything's available, only this. I've been to more than a dozen hospitals now here in Kansas. I've talked to more clinics than that, probably about 100 physicians about what's going on in healthcare today. In every situation, whether that's a doctor or a clinic or a hospital, when they receive funding from the government, either in Medicaid, Medicare, or even veterans benefits, the government never fully reimburses the costs. In fact, for Medicaid, sometimes it's only 25% of the cost. It goes up to 70% on some treatments, but it never fully funds the cost. So in every case, whether it's a physician, clinic, or hospital, they use the term cost shifting. They take what they collect from private insurance and cover the shortfalls on public funded health care. Well, every plan that we've seen here, in fact, S-CHIP used to be a good program. It started out taking kids in the poverty level and then giving them access to Medicaid. And you know, that's a good thing, because it does get them out of the emergency room into a regular care. If it was funded properly, it would probably be better. But when they changed health care this year, they moved it from poverty level up to 300% of poverty level, and people who are currently on private insurance can be moved off into public funded insurance, and here's how that works. Say you're an employer, you've got a small company, 10 employees. You currently have health insurance, and what does it cost? About $500 a month per employee. If it's in that range, then it's about $6,000 a year, 10 employees, $60,000 a year. But this employer now has the opportunity, because of S-CHIP, to say, well, you know, I love all 10 of you. And I used to have this good health insurance plan that you enjoy, and I've never heard any complaints. But you can also get health insurance from the social rehab services. So I'm taking you off my private plan, and here's where you go to the SRS office to apply for your health care. And pushes them, because of the economic advantage, into the public funded health care. Today in America, 17% of our economy is health care. 60% of that is funded by private insurance, 40% by public health care. That 40%, the shortfalls are covered by the 60%. But when you have programs like S-CHIP this year, and by the way, I was the only one in Kansas to vote against it this year. No, this year it was Lynn Jenkins stood with me. Only one of us two voted against it. But when you shrink the private funding of health insurance, you put a bigger burden on the public funded health care. And when you do that, you see problems like Jenny Job is facing. Physicians, clinics, hospitals have to make a decision. Can we afford to provide this care? 1 out of 3 doctors in Kansas today no longer takes new Medicaid or Medicare patients because they simply can't afford to do it. I talked with a surgeon here in Johnson County, and he said, if somebody really needs surgery, I'll just do it as a donation, because I can't afford to handle all the paperwork. I'd have to hire 2 additional people. I have a very small office. And then there's this complaint board that they have that I would have to sit through every time. He says it's such a long, protracted, highly regulated process, I'm simply not going to do it. Well, that's not the healthcare system that I want to see for America today. I believe that we ought to pursue where technology is taking us. You know, where they're taking us at KU Cancer Center, because of the Human Genome Project, they can take a droplet of your blood, map your DNA, and tell you what you're susceptible to, what you're suffering from, and the personalized treatment that you should receive. compare that to, contrast that with comparative effectiveness, where it's a one-size-fits-all. Well, the three phases that I believe they're using in the Obama administration started with comparative effectiveness. The next one is where they're going to have a public health insurance company compete with private health insurance. This is a loser. Think about a subsidized business competing with the private sector. I mean, I saw this in aerospace. I used to work at the Boeing company, worked there for about 14 years. Best temporary job I've had so far. In that case, whenever we were bidding against the federal government, they always eliminated some of their cost structure, things that the Boeing company had to report on. We had to account for every penny that was being spent. But they could forget things like, health benefits. You know, everybody in the government has health benefits, so we're not going to include that in the price. Well, I had to go through the protest procedure, bring those costs back into the bid. Or part of the overhead. You know, those buildings are going to be there for a long time, and this program only runs for the next 3 years. Well, Boeing had to account for the overhead, so I would have to go back and protest their bid and make sure that they included all the costs, the same costs that were demanded by the federal accounting standards and that we complied with. So having the federal government compete with the private sector in insurance is going to be a loser for the private insurance sector. And when that happens, that'll be the second phase for socialized health care. The third phase is it's going to be economically feasible to push people out of private insurance into public funded health care. And when that happens, we'll have a system similar to Canada or the United Kingdom or Germany or anywhere else. We had an economist come from Princeton to the Labor, Health, and Human Services Subcommittee that I'm the ranking member on. And he said, you know, they got wonderful systems over in places like the Netherlands, and it's a lot less expensive to have health care in the Netherlands. Well, you want to know why? After age 72, you don't get any health care treatment. They give you a pill which will take your life. Of course that's cheaper. We can produce hundreds of pills, but it's not a natural death. That's not the healthcare system I want for myself, or I want for you, or I want for my kids and grandkids. So I'm fighting. I'm taking it to them. We started by fighting the stimulus, and I've done some risky things. You know, I'm trying to get hired as your next U.S. Senator, and I have less money than my opponent. But I'm still running ads now because of what I read about Abraham Lincoln. In Doris Kearns Goodwin's book called A Team of Rivals, she tells the background of the four candidates in the 1860 presidential election. Lincoln, after he became elected, hired the other three to be part of his cabinet, so thus the team of rivals. And they all were unique and they were very strong-willed people, but he somehow managed to bring them all together. But in his background writing, she talks about the 1858 senatorial campaign, the Lincoln-Douglas debates, as you know. And in the first Lincoln-Douglas debate, Abraham Lincoln said, with public sentiment, anything is possible. Without it, nothing's possible. So those who form public consent are more important than those who vote on statutes or render decisions, meaning the legislature or the courts. Forming public sentiment is a very important part of our society and our cultures today. We need to form public sentiment as Republicans to try to change the outcome of the 2010 elections. We have to start driving this issue of opposing the stimulus, oppose borrowing this money, oppose the inflationary cycle that they're trying to drive to pay back this humongous